Okay, in this video, we're going to look at the criteria for what makes something a psychological disorder, something that actually needs a clinical psychologist or a psychiatrist, as opposed to an idiosyncrasy or something that's just kind of unique to us or kind of strange that we do. We all have idiosyncrasies. So, for example, I like to turn my radio to levels of 4 in my car. It's got to be 20 or 24 or 28. I like even numbers. Now, that's an idiosyncrasy. That's not a psychological disorder. And the reason it's not a psychological disorder, it's just a strange thing I do, is that because a psychological disorder has a person show some kind of suffering or distress, they have extreme anxiety, it inflicts or causes pain to themselves or others, where it's something that it's gotten to the point where it interferes with their daily life and they can't actually function. So that's when something actually becomes a disorder psychologically, and it's going to need some other interventions. Now, the behavior goes against the norms, normal acceptable behavior of society. So I've heard of everything and seen some unique things myself when I worked at a psychiatric ward with children uh, and worked in a boys' home that I can't talk about. However, I've heard of things like somebody rips the buttons off their shirt every day, and then somebody will put the buttons back on. Well, that is something that's interfering with their life. If they're constantly doing this to the point where they can't focus on anything, and if they don't rip the buttons off their shirt, they can't get through the day. So that is a psychological disorder that might need some interventions or somebody to help them through the situation, as opposed to just ignore, because you can't go to work with your shirt wide open and unbuttoned. People would think that's against the norm, acceptable behavior. So we can intervene, and those interventions might be going to a therapist or a psychiatrist depending on the situation. Now, the behavior is maladaptive, cannot adjust or adapt to situations. That is another sign that something is a psychological disorder. So, for example, if you walk into a large room with people, or you go to the mall, somebody can't go into the mall because they have agoraphobia, which means they're scared of big open spaces with lots of people. Well, that could actually be detrimental or destructive to their life. If you can't go to the mall, or you can't go to a job, or you can't even go to a college class because there's too many people in the class, and then you'd rather stay on the outside of the class and fail the course than to actually go in the class, that's really having negative consequences on the quality of life you have. So if it's affecting your quality of life or others, that is a big sign that it is a psychological disorder. If you can't adapt to the situation, or a person can't adapt to the situation, they're maladaptive to just regular situations, like they can't go to dinner at a restaurant, or they can't drive a car because it's nerve wracking. They have a fear that they're going to get in an accident, or they can't take tests because they get so much anxiety that they just fail. That's when we need some kind of counseling or interventions. And then the last thing we're looking at for now is I'm going to add that back in. Sorry. And we have to think about is the behavior itself, the behavior causes the person to be dangerous to self or others. That is clearly a sign that is a psychological disorder. So are they hurting other people? Are they going to hurt other people or hurt themselves? Well, that's a psychological disorder. Like many of you have probably heard of cutting or cutters. People that sit there and they'll use like a razor blade or something sharp and cut on their arms and stuff. And that's maybe to cause pain, and sometimes it's not because they like the pain, it's to distract them from something else that's really causing a lot of anxiety or bothering them. So they're trying to focus on the pain as opposed to whatever's in their head they're hearing or seeing, or it's really causing them mental anxiety. And people forget that mental health is as important, if not more important, than physical health. And we're going to go into that mental health can cause physical illness. So, and that's where we're kind of going right now. So, what are somatoform disorders? So, somatoform disorders are disorders in which people believe they are sick when they're actually not. You guys have all heard of hypochondriacs. Hypochondriacs are people that are constantly need everything clean. They're scared of germs and bacteria, which is just a part of life. But, and not to say we should all be clean, but they're to the point where they can't function as a person. That's when it becomes hypochondria. So, for example, I wash my hands before every meal. Try to wash my hands before I touch my face or touch anything, and get the bacteria off, because I don't get myself sick. That doesn't necessarily make me a hypochondriac. That doesn't really interfere with the quality of my life. Me needing to go to the bathroom to wash my hands before I eat just makes logical sense. However, if I was a hypochondriac, I would like freak out because food's on a plate, and I don't know if the plate's clean, so I have to bring my own plates, or I have to bring my own silverware, or I can't eat out in public at all. That's actually affected me where I can't meet with other people. Now, these disorders are different from psychosomatic or physiological disorders in which an individual experiences the actual illness that they believe to be caused by a psychological stress. So, a somatoform disorder is something that you think you're sick all the time or something's wrong with you when there's nothing actually wrong with you. Now, a psychophysiological disorder or psychosomatic disorder is you're actually making yourself sick. Like you have anxiety to the point that you're throwing up. Like you have stomach ulcers. That can happen because mentally you're making yourself sick all the time. You can't sleep and you have insomnia and you stay up all the time. Well, that can actually cause you to get sick. You can break down your immune system, and you're much more likely to get sick if you have psychosomatic disorders or you have you can't sleep at night and you're staying up. So somatoform is, I think that I have a disease or I'm ill when I'm not. Somatoform disorders include hypochondriacs, as we just talked about, or a disorder which a person worries excessively about becoming ill. I can't open the door. Why? It's going to make me sick. I need to wear gloves. I don't have gloves on me. I can't go through the door without the gloves. Like they're just constantly going back and forth with all this anxiety and stress, and they're worried, and they can't get to work on time. They can't do their schoolwork. They're depressed. It turns into other consequences as well. That's a somatoform disorder versus a psychosomatic disorder, which is you're actually making yourself sick. Like you are really giving yourself ulcers with all this anxiety. Now, there's two types of therapy we're going to talk about, and this goes much more in depth. But for that, you would need to take a psychology class on clinical psychology, and you get much more informed on this. But this is just introduction to psychology, so we're just talking about two probably the most popular or ones that people have heard of. The first one that was started was by Sigmund Freud. Now, Sigmund Freud created the first one, and what we call this meeting of people's psychological disorders is therapy. So therapy is when psychological disorders consist of treatment methods aimed at making people feel better and function more effectively. Just to be clear about therapy does not always focus on solving the issue, okay? Some things aren't solvable. And it's okay to have a psychological disorder. However, a therapist and therapy tries to make it livable. So some stuff just needs to be made to the point where you can live with it. And some abnormal behaviors that we do in public, if we do those in public, it could actually hurt us to the point where we can't work or provide for ourselves or take care of our family and friends. So therapy goes into not necessarily resolving everything or solving the problem. And some therapists do believe you should try to solve the problem. But I think the majority of therapists would say we're just trying to make it manageable, make you adaptive enough to the situation so that you could succeed. Now, these are the two main types that we talk about. The first one is the very first and most famous originally is probably psychotherapy. Psychotherapy consists of talking things out with a professional, okay? Mind therapy. You talk it out. A psychologist might be over $150 an hour, $100 an hour. A psychiatrist is a whole nother ball game. They might be more like $500 an hour because they're a medical doctor and they can prescribe medicine. So, for example, if somebody has anxiety disorder, most people would say you need to start with psychotherapy, and then if it's that bad, then maybe you might have to go to a psychiatrist. And the psychiatrist is not they might do psychotherapy, but They're more so on the biomedical therapy side of things. That consists of using biological methods such as medicine or treatment of psychological disorder. So most people will start out with a psychotherapy, then they'll move up to biomedical therapy. So let's be clear on this. Psychotherapy would be, I have an anxiety disorder. Let's say I am a hypochondriac and I'm afraid of germs everywhere. Well, I meet with a therapist. First of all, the therapist, you have to really like them and trust them. So you get through your problem, you have to respect the psychotherapist and make sure you find somebody that you yourself believe in and trust. So I meet this therapist and I'm like, ooh, I really connect with them. A lot of times people connect with therapists because they see some kind of relationship to them. Like I'm a male, they're a male. I'm white, they're white. Or maybe they have or I'm African American, they're African American. Or a lot of times it's some kind of connection and I feel connected to this person. Then they can start talking to me and I feel safe. Like I'm confident that they're not, whatever I say in this therapy session, they're not going to say to anyone else, which they should never. That's the law, and that's kind of the code of ethic of a psychologist or a psychiatrist, is that the code is that you keep it between us. It's confidential. But I have anxiety, and I'm scared of this, and this is really embarrassing that I need to wash my hands after I touch a doorknob, and then I can't think about anything else but that, and I don't do high fives. Okay, so they're going to say, well, where does this fear come from? Would be one approach. Or let's start at the beginning, depending on what approach they take. What do you think is the cause or the root of this? And then let's try to take baby steps in psychotherapy. So most therapists are probably not going to have you, okay, tomorrow I want you to touch on everything without washing your hands for an hour, and then you can wash your hands and just see if you can deal with it. That would be traumatic. That's too much. So they'll start off with little baby steps, like tomorrow or by next session, I want you to be able to turn the doorknob once or twice, and then we'll go without washing your hand for a little bit. See if you could do that, maybe once or twice next week, and see how that goes, and come back to me. And we do this back and forth until we can kind of wing you to the point where it's manageable, where you could open most doors without washing your hands all the time, okay? Now, we've talked about this in the past, you have other disorders cannot be handled with just psychotherapy. There's a lot of conditions where that's not going to work. Bipolar is a constant one. A lot of people with bipolar need to take medication. There's a chemical imbalance in the brain. There's too much dopamine, or there's something going on. So they might try to get your levels in check, and the challenge would be trying to get the person to trust the therapist and to trust the psychiatrist that, hey, it's going to take 40 days for one medication to work before we even know. And then, again, just because you try a medicine for 40 days doesn't mean it's going to work. We might have to give you more medicine or less medicine. If it's too much, you might feel tired and sluggish. If it's not enough, it's just not going to work, or you're going to be like, this is a waste of money and time. Try to be patient with me. Also, you've got a lot of conditions that there's biomedical issues where there's the chemical imbalance, and depression can be biomedical or it could be psychotherapy needed. So sometimes people are just depressed and they need to talk through it, and I think most doctors and most therapists are going to start with the psychotherapy is like, can we talk through your depression? What's going on with you? What are some things that are in your locus of control you could work on to make yourself better? And then what are things that are pushing on you that are outside of your control? Biomedical, then if that doesn't work and there's an actual chemical imbalance in the brain, then you need a psychiatrist. Then you need somebody who can come in and be like, all right, I might have to give you something that makes you feel better, okay? You might have to take some of these drugs. Now, some of these biomedical drugs can be very dangerous because if anything's based on any kind of opiate-based drugs, we found out are very addictive and could lead to other problems. However, if there's a chemical imbalance in the brain, that person might be at the point where they need that so they can adapt to situations and live a happy life. And we can find the right dosage and work with the person.